Hello, I'm Aaron Terranova, Clinical Coordinator for the University of North Carolina, Greensboro, Master of Science Athletic Training Program, and welcome to our continued Preceptor training. As you remember, we have 5 modules, so I'm hoping you've already completed Module 1, and we're going to go now through Module 2, which is basically a snapshot of UNCG. So UNCG, we had initial accreditation back in 2004. We're one of the oldest programs, if not the oldest program in the state of North Carolina, and one of the oldest ones in the country who have been a continuous entry-level master's program. We started as entry-level masters, and we've sort of been there the whole time. We got continuing accreditation in 2018, and that'll be good for 10 years. We are housed in the Department of Kinesiology, which is in the larger School of Health and Human Sciences here at UNCG. Now, a little bit about our students. You're probably going to see this with a lot of students, especially at the graduate level. They are highly internally motivated. They know why they are coming back and why they are in the athletic training program. They enter the program with a lot of experience. Some come with thousands of hours of observing at their undergraduate program. Many are ex-athletes who have experience from the other side of the treatment table. And these allow us to try to accelerate our program and try to move the same amount of content in a shorter time frame. For some of our older preceptors who went for the undergraduate model, we're basically trying to do a 4-year undergraduate in a 5-semester or 2-year program. So you have to have a very purposeful strategy to that, and you have to have students who are willing to buy in and put the work. So that's kind of who our students are and the type of student we want coming here to our program. Now, one thing you need to sort of know also about the typical college student. Again, our younger preceptors, you probably already know this, so I apologize if I'm beating the dead horse here. But college tuition has just absolutely blown up in the last few years, as this graph clearly illustrates. And most of the students, especially undergraduate students, they're working part-time jobs or even sometimes full-time jobs during their undergraduate. And actually, when they come to graduate school, they still are looking to do that. Now, our athletic training programs don't have assistantship. So for those of you who went for the old undergraduate model or hired as a GA and had a stipend, the current Katie does not allow that. So our students don't have any sort of stipend. So they're counting on scholarships, awards, and even part-time work to help supplement their income and pay the bills. Again, most of our grad students aren't living on campus and don't have a meal plan, so these are all added expenses. Factor in also the fact that you may have some outstanding debt from undergraduate, and financial considerations is a huge burden for our students. And as much as we like to think that our students will just drop everything and come into our program, that's just not reality now. And if you look at the statistics right now, student debt obviously is ginormous, and it is a burden on our students. So we take that into consideration. We ask that you as a preceptor at least understand that. Now, the caveat is we tell all our students that the clinical experience is first and paramount, and we don't want them ever sacrificing their clinicals for something else outside of UNCG, as legitimate as it is. And I'm hoping that you as a preceptor work with the student and work with myself as a clinical coordinator to find a way to keep the experiences for the student in a clinical setting high level, while at the same time not sacrificing any of the patient care that they would be giving with their patients, and also appreciating that the student may need to have some sort of income to allow them to continue in their schooling. But take all of that aside, we have some really great students. We have students who have won awards at the state, district, and national levels. We have students who want to learn, are thirsty for knowledge. We have students who will challenge you as a preceptor. They may come back to you with a recent reading, a supplemental article, or just a lot of questions about your personal philosophy and how you got there. So again, we are a wonderful program that embraces all different types of students. And we hope you as a preceptor will appreciate that also. Feel free now to move on to Module 3. Thank you.